You may know actor Eric Dane, who played Dr. Mark Sloan on Grey's Anatomy for 6 seasons. At just 52 years old, he revealed that he was recently diagnosed with ALS. I'm Dr. Betsy Grunch, a board-certified neurosurgeon, and let's talk about what ALS is, also known as Lou Gehrig's disease. ALS stands for amyotrophic lateral sclerosis, which is a progressive neurodegenerative disease. It specifically targets the motor neurons. Those are the special cells in our brain and spinal cord that control movement. Basically, what happens in this disease is those neurons degenerate over time, cutting off the control of the brain to our muscles. So patients with this disease slowly lose their ability to walk, to speak, to swallow, and eventually breathe. The symptoms of ALS often start pretty subtly. Sometimes it starts with slurred speech, sometimes weakness in the arm or leg, and over time that slowly progresses. But here's a very common misconception. It does not affect their sensation or their cognition. So their mind is still there and they can feel everything, but they just can't move. Eric has revealed publicly that he's in the early stages of the disease. That means he could be experiencing mild weakness, fatigue, or even muscle twitching, also known as fasciculations. Diagnosis of ALS is clinical, supported by EMG findings and MRI findings to rule out other mimickers of this disease, and of course a detailed neurological exam. ALS can mimic other diseases like cervical myelopathy, which often I see in my practice, even other multifocal motor neuropathy. Sometimes making the diagnosis can be difficult and take time. There's no single test to make the diagnosis. There is no current cure for ALS, but we do have treatments. These medications can help protect the neurons from oxidative stress and can slow the progression of the disease by reducing glutamate toxicity. And other assistive technologies like speech devices and mobility aids can help maintain quality of life. Clinical trials are ongoing. There are gene-based therapies that are emerging as a real frontier, especially for familial ALS. The median survival for people with this disease is 3 to 5 years. Eric's diagnosis is bringing visibility to a disease that's often misunderstood. While this disease is devastating, awareness will fuel research, compassion, and progress. So let's keep talking about it. And Eric, I am wishing you all the best.